health services and education on responsible parenthood and reproductive health. This includes family planning services. What is family planning? Family planning is a means to attain the desired number of children and determine the spacing of pregnancies. It refers to a program which enables couples and individuals to decide freely and responsibly the number and spacing of their children, to have the information and the means to do so, and to have access to a full range of safe, affordable, effective, non-abortifacient, modern, natural, and artificial methods of planning pregnancy. The family planning program of the Philippines started in 1967 when the leaders of 12 countries, including the Philippines, signed the Declaration on Population. The Philippines agreed that the population problem should be considered as the principal element for long-term economic development. Any choice and decision with regards to the size of the family must rest within the family itself and cannot be made by anyone else. They must be made aware of the alternatives open to them. The right of every family to information and the availability of services in the field is considered as a basic human right. According to studies, around 2 million pregnancies in the Philippines were unplanned, 59% of which were terminated by abortion, and roughly 500,000 will be unsafe. As a result of this, 1,000 mothers died due to abortion complications. This is apart from the economic loss from early pregnancy among adolescents. Why do we need to invest in family planning? Family planning is a health intervention. It is a means to prevent high-risk and unplanned pregnancies. It is a means to prevent abortion, to reduce maternal and infant deaths. It's a reproductive right of women, and it is a means towards responsible parenthood and as a means to reduce poverty. It is essential to ensure the well-being and autonomy of women while supporting the health and development of communities. Who are high-risk mothers? They are mothers who are 35 years old and above, mothers who has birth interval of less than 3 years, mothers who have 4 or more pregnancies, mothers who have chronic diseases or disorders, and mothers who are below 18 years of age. If childbirth could be postponed until the too young mother is old enough, and aborted in mothers who are too old and too ill, the impact on both maternal and infant mortality would be significant. Short intervals of less than 3 years between pregnancies are associated with greater risk for adverse outcomes such as maternal death, third trimester bleeding, premature rupture of membranes, uterine infection, maternal anemia, abortion, and low birth weight. Thus, the importance of initiating the use of contraceptive method at postpartum should be highlighted. The possible pregnancy complications of mothers who are at advanced age includes the following: hemorrhage, prolonged labor, and toxemia. As a woman's age advances, the muscles of her uterus also become less firm, making pregnancy and childbirth more difficult. Infants born to elder women are also at much greater risk of having the following problems: heart defects, birth defects which include cleft palate and lip, Down syndrome, and a higher incidence of stillbirths and fetal deaths. For women who have had more or more deliveries, they are more likely to experience problems during pregnancy and labor and often require cesarean section, which may not be readily available nor performed early enough. They have a significantly higher risk of miscarriage and perinatal mortality than women undergoing their second or third delivery. What are the complications if the mother has chronic illness? Pregnancy complicates physiological processes of treatment and rehabilitation. Pregnancy adds burden to a body already burdened by disease. This also poses danger to the infant due to the adverse effects of medications being used to treat the disease, including congenital malformations and stillbirths. What are the benefits of family planning to the mother? Using an effective family planning method, reduces maternal deaths by preventing high-risk pregnancies among women who are too young, too old, or too ill to bear children safely. Maternal deaths can be prevented if unplanned pregnancies are avoided and pregnancies are spaced by at least 3 years. Prevention of closely spaced pregnancies that leads to and worsens such conditions as anemia and maternal malnutrition. What are the benefits if the birth interval is at least 3 years? The mother is able to completely recover her health and nutritional status. The children become more resistant to infections and communicable diseases. It enables family members to participate actively in socio-economic development. Recent studies indicate that the lowest risk for fetal death, preterm delivery, being small or undersized for gestational age, neonatal death, and low birth weight occur when births are spaced from 3 to 5 years. What are the benefits to infants and children? Properly spaced children for at least 3 years will be given attention, care, and time from mothers and fathers to attend to their growth and development. Fewer children in the family means being able to provide more opportunities for adequate food, clothing, good education, and good health. Breastfeeding can protect infants against diarrheal and other infectious diseases, as well as protect mothers from postpartum hemorrhage. The rights of family planning clients must be honored through appropriate family planning counseling. Clients must be able to make voluntary and informed choices based on accurate, balanced, and complete information. The Department of Health recognizes that ensuring informed choice and voluntarism will translate to better and longer method use, improved client compliance, and satisfied clients who will encourage others to participate in family planning programs. It is the vital foundation of family planning program success. Having discussed both the family planning benefits and properly spaced birth intervals, we now proceed to the provision of FP services. This figure illustrates the flow of activities and services for a new FP client in a given health facility. This reflects the specific steps to be followed and the key decision points to be made while clients are being served in the clinic. Number 1. Once the client enters the facility, ask if the client has a method in mind. If they have a method in mind, assess the client's needs and discuss the FP methods, including their method of choice. If none, assist the client in choosing a method. Once they have chosen the method, based on the client assessment, check if the client is eligible for the chosen method. If not eligible, help the client in choosing another method. If the client is eligible for the method, you may now explain the details on how to use the method, what to do if there are side effects, and advise if dual protection is needed. Once the chosen method is discussed and confirmed, obtain written consent. Then provide method or refer if necessary. Don't forget to remind client of next visit before sending home. We use this guide in providing FP education and client assessment. The Gather Counseling Process. Gather stands for G. Greet the client. A. Ask the client about herself or himself. Assess her or his knowledge, needs, and risks, including risks for STDs like HIV and AIDS. T. Tell the client about family planning methods based on her or his needs and knowledge. H. Help the client choose a method. E. Explain how to use the method. And R. Return for follow-up and refer for services. Findings of the client assessment is looked up in the WHO Medical Eligibility Criteria or the MEC using the MEC wheel or summary table, which will be shown later. The MEC is based on the latest clinical and epidemiological data available on the safety of FP methods for people with certain health conditions. Based on these recommendations, the eligibility criteria for initiating and continuing the use of a specific contraceptive method are classified under one of four categories. The four categories are: Category 1 is a condition for which there is no restriction on the use of the contraceptive method. Thus, you provide the method. Category 2, a condition where the advantages of using the method generally outweigh the theoretical or proven risks. This indicates that the method can be generally used, but that careful follow-up may be required. Category 3, a condition where the theoretical or proven risks usually outweigh the advantages of using the method. Use of this method is not recommended unless other, more appropriate methods are not available or acceptable. Category 4, a condition which represents an unacceptable health risk if the contraceptive method is used. Do not provide the method. In summary, only FP methods with categories 1 and 2 can be given, while FP methods under category 3 and 4 must not be used. This is a sample of an MPC wheel. This wheel matches up the contraceptive method shown on the inner disc with specific medical conditions shown around the outer wheel. The numbers shown in the viewing slot inside the green and red box tell you whether the woman has this kind of condition is able to use this method. For example, a woman with sepsis or post-abortion can use any of the following FP methods: combined hormonal contraceptives, progestogen-only pills, injectables, or implants, as they are labeled as Category 1, while IUD is under Category 4 and must not be used. There are two types of FP methods: modern methods and traditional methods. Under the modern methods, we have the artificial and the natural, or the fertility awareness wheels. Here are the artificial modern methods, which can be subdivided into long-acting methods and short-acting methods. Under the long-acting and permanent methods, we have female sterilization, male sterilization, IUD, and subdermal implants. Under the short-acting methods, we have injections, pill, and male condom. These are the natural modern methods. The following are traditional methods: withdrawal and calendar or rhythm method for periodic abstinence. However, these methods are still considered unmet need for modern family planning. We want our women to use a more effective method in FP to prevent unplanned pregnancy. Now, let's discuss modern family planning method. Let's first start with artificial modern methods. Under long-acting methods, we have implants, IUD, female sterilization, and vasectomy. While for short-acting methods, condoms, injectables, and pills. Female sterilization, which includes ligation or BTL, it's a safe and permanent FP if you do not want any more children. It is a procedure done by a doctor to cut and tie the tubes that your egg cells travels through, making sure that the egg cannot meet a man's sperm. It does not affect your ability to have sex or how sex feels. You will still get your period. Male sterilization or vasectomy. It is a safe and permanent FP for men who don't want any more children. In a day or two, you can carry on with your usual activities. It is a procedure done by a doctor to cut and seal only the tubes that carry sperm out of the body. This stops the sperm from mixing with the semen and leaving the body. It does not affect your ability to have sex. It does not change how sex feels or the way semen looks. Intrauterine devices. They are usually small pieces of flexible plastic shaped like a T with a short piece of string at the end inserted into the uterus. It can be removed earlier if the client wants to get pregnant. Common experiences includes most of them use this without a problem but may experience the following: discomfort and cramping when the IUD is placed and during menstrual period, changes in the menstrual cycle which may be more frequent, longer, or shorter. These are normal and will go away in a few weeks or months. Implants. The client will get a small flexible rod about the size of a matchstick placed under the skin of her arm. The implant will prevent pregnancy for 3 to 5 years depending on the brand. It is safe for breastfeeding women. It can be removed anytime if you want to get pregnant. Common experiences include few days of mild soreness in the arm when inserted, changes in the menstrual cycle, weight change, breast tenderness, dizziness, and headaches. These are normal and usually don't last long. Injectables. This is given as an injection every 2 to 3 months depending on the brand. It works really well if you always get it on time. There is also a type of injectable that is safe for breastfeeding women. The client can stop using it if they want to get pregnant. Most use these without a problem, but may experience the following: changes in menstrual cycle, weight change, dizziness, and headaches. These are also normal and should go away after a few months. Male condom. Your partner puts this thin rubber cover over his erect penis before sex to keep the sperm out of your vagina. It protects against pregnancy and diseases that can be acquired through sex, such as STI and HIV. You can use it with other family planning methods. You may use it correctly every time you have sex. You can stop using it if you want to get pregnant. Some couples find it hard to use a condom every time they have sex. Clients have to have a supply on hand. Pills. The client takes a pill which contains a small amount of hormones every day. It comes in a monthly pack and the client should take one pill every day, whether or not she had sex that day. The pill is safe, affordable, and effective if always taken on time. With progestin-only pills are taken if the client is breastfeeding, while the combined oral contraceptive pills are for those who are not breastfeeding. Common experiences include changes in menstrual cycle, weight change, breast tenderness, dizziness and nausea, and headache. These are normal and usually don't last long. Now let's go over the natural modern methods. The lactation amenorrhea method, or the LAM, is based on the natural effect of breastfeeding against ovulation. It is reliable and effective, provided the three conditions are met. 1. The woman's menses have not yet resumed after giving birth. 2. Breastfeeding is exclusive, means breastfeeding her baby at least every 4 hours during the day and every 6 hours at night. And feed her baby only breast milk. 3. The baby is under 6 months old. Common experiences include finding it difficult to breastfeed on demand for 6 months. They need to remember that before their period comes back or before their baby turns 6 months old, they need to shift to a different type of family planning to prevent pregnancy. Fertility awareness methods. You use these to track days when you are fertile or ovulating so you can avoid sex and not get pregnant. Examples of these are the calendar-based methods and the symptom-based methods. These methods are effective if you are able to monitor and chart your fertility daily and you have a regular cycle. You and your partner must avoid sex, or you may use another type of family planning during fertile days. You can use a tracker on your phone or a calendar to remind you. This table shows up to when each family planning type can prevent pregnancy. For implants, it is good for 3 to 5 years, pills 1 month, IUD 5 years to 12 years, injectable 2 or 3 months, condoms every time you have sex, fertility awareness methods as long as you abstain from sex or use another type of FP on fertile days. Postpartum family planning is among the priority strategies of the program and one of the high-impact practices in FP. According to the latest national survey, 78% or 8 out of 10 women in the Philippines give birth in a health facility, making them eligible target beneficiaries for the FP services. More often than not, postpartum women are motivated to avoid an unplanned pregnancy soon after giving birth. Counseling for postpartum FP, therefore, should begin during their prenatal visits. Proper understanding and adequate preparation for certain methods will make the provision of these methods easier soon after delivery. Counseling and FP service provision can also be carried out during the vaccination visit of the woman for her baby or any other reason for her clinic visits. If you think your family is complete, here's what we recommend for you. FP type ligation is permanent. Vasectomy is also permanent. It's never too soon to think about FP. Good methods for you include implant, IUD, LAM, and special pills for breastfeeding women. If your family is complete, consider a permanent method like ligation or vasectomy. Talk with your doctor or midwife before you give birth or soon after to choose the best method for you. Immediately during postpartum, the mother has several contraceptive options if she wants to delay her next pregnancy. This figure presents the recommended family planning methods that may be used during the first year postpartum and beyond based on the MEC for contraceptive use. All women, breastfeeding or not, can initiate use of condoms immediately after birth. IUD can be inserted immediately after birth up to 48 hours postpartum or at any time after 4 weeks postpartum. Female sterilization can also be performed immediately up to 7 days after birth or at any time after 6 weeks postpartum. While progestin-only methods can be initiated immediately following birth, as seen in the diagram for all postpartum women. For breastfeeding women, from delivery up to 6 months postpartum, a woman who is exclusively breastfeeding and has no menstrual period yet can use the LAM method safely. When the client uses the LAM and decides to change to another method, or when the client no longer fits the criteria, other contraceptive methods should be provided in a timely manner. Combined hormonal contraception cannot be initiated until 6 months after birth. For non-breastfeeding women, combined oral contraception can be initiated 3 weeks after birth. Informed consent is different from informed choice. Voluntary informed consent must be obtained in writing before providing a client with any clinical service during the initial visit. The consent form should be explained to the client and includes the routine procedures that will be performed. Prior to signing the consent form, the client must have received all the necessary information, must have been given the opportunity to ask questions or clarify issues, must have received the appropriate answers and clarifications, and must have understood all information correctly. And so, that ends my presentation. I hope that you were able to learn the knowledge and skills in the provision of primary care services for adults and be able to use them in your actual practice. Maraming salamat po sa inyong lahat at mabuhay!